Did you know that malpractice expenses for the exact same physician and coverage can fluctuate 1,300% across the U.S.? Today, I'm going to show you some never-before-seen data on physician malpractice expenses, and I'll explain how tail coverage is priced. Hey folks, welcome to the Dr. Deals podcast, where we talk about healthcare business transactions. I'm Nick Newsad from healthcontract.com. Whether physicians are independent or employed, malpractice premiums can vary a lot depending on physician specialty, geography, coverage limits, deductibles, group size, whether occurrence or claims-made coverage is issued, and other factors. To prepare this episode and the accompanying article, we interviewed a malpractice insurance expert from the national insurance carrier Copic Insurance and conducted a national review of physician malpractice premiums in 20 states and the District of Columbia. I encourage you to review the full 3,000-word article at healthcontract.com. The first factor I want to cover on the podcast is geography. Geography has a major impact on malpractice premiums. We reviewed 254 real neurosurgery malpractice premium rates for the exact same claims-made liability coverage in 20 states and the District of Columbia. Malpractice premiums for the exact same coverage varied over 1,300% across these 21 markets. Neurosurgeons in parts of New York and Illinois pay 10 to 13 times more for their coverage than neurosurgeons in other parts of the country like Georgia, Minnesota, and Tennessee. Premiums for the exact same coverage varied up to 300% within different parts of New York State alone. Given these large geographic differences, it goes without saying that the national median malpractice expenses reported by medical association surveys like AMGA are not reliable business statistics. This can come into play when hospitals contract with independent physicians for coverage. Using the raw neurosurgery data from our sample, the impact of malpractice premiums on hourly compensation for independent neurosurgeons contracted under professional service arrangements, service line subsidies, and on-call coverage can vary from $15 to $225 per hour. The next factors I want to cover are specialty and scope of practice. Across all specialties, carriers nearly always assign the highest premiums to physicians who perform major surgery. Physicians in the same specialty who only perform minor surgery have relatively lower premiums. Specialists who do not perform surgery have the lowest premiums. Across states, neurosurgery and bariatric surgery usually top the list of the highest premiums across all carriers. OBGYN and other types of surgeons usually follow. Pain management specialists performing advanced procedures also rank at or near the top of the list for carriers in some states like Texas and Mississippi, but not others. Psychiatry, occupational medicine, allergists, and specialists who do not perform surgery tend to have the lowest malpractice premiums among physicians. Malpractice insurance carriers in different states rate specialties differently. For example, the California malpractice carrier shown on the screen assigns far more risk and higher premiums to neurosurgery than other specialties. The North Carolina malpractice carrier shown on the screen ranks OBGYN and maternal and fetal medicine higher than neurosurgery in terms of malpractice premium rates. In other states, some carriers assign the highest risk and premiums to bariatric surgery, trauma surgery, or pain management physicians who perform advanced procedures. The last topic I want to cover on this podcast is extended reporting period coverage, or tail coverage. When a physician employee leaves a medical group with a claims-made coverage policy, the physician becomes vulnerable to legal claims related to incidents that occurred before his or her policy was canceled. Extended reporting period coverage, or tail coverage for short, is expensive, but it can protect physicians from claims that occurred after their claims-made policy is canceled. Depending on how long the physician was employed at his previous employer, the one-time lump sum cost to get tail coverage could be 200% of the annual premium under the canceled policy. We reviewed tail coverage rates for 30 insurance carriers across 9 states. The most common tail rate factor was 200% for physicians who had been covered at least 3 years under the canceled policy. Here's an example. If annual malpractice premiums for a neurosurgeon were $100,000 per year under a standard claims-made policy, then the one-time cost for tail coverage could be a $200,000 lump sum payment. That's a large expense for an individual physician. To learn more about tail coverage and who typically pays for it, check out our full article on this topic at healthcontract.com. And after you're done reading that article, let's do some doctor deals.